Hey, if you're getting ready for the EMREE 2026, you are in exactly the right place. Today, we're going to break down the blueprint you need to stop studying randomly and start studying smart. We're going to make sure every single hour you put in actually moves the needle.
So let me ask you a question right off the bat. Are you spending your time on the subjects you find kinda interesting, or are you laser focused on what the EMREE is actually designed to test? It is such a common trap, and it's probably the biggest reason why so many smart candidates don't get the score they deserve.
And that leads to this huge problem. Most people preparing for this exam waste precious weeks, sometimes even months, just studying, with no clear blueprint. They cover a lot of stuff, but it's not the right stuff. This explainer is all about getting you that blueprint, that structure, so you can study with real confidence.
Okay, so let's start by digging into this thing I call the random study trap. Because to beat it, you first have to really understand what the EMRE is all about.
First things first, EMREE stands for the Emirates Medical Residency Entrance Exam. Now, the most important thing to get straight is that this is not a simple pass-fail test. It's a ranking tool. Your score directly impacts where you land in the residency match. So the goal isn't just to pass, it's to get the highest score you possibly can.
So what does this exam really test? This is where you have to get into the EMREE mindset. This is not about memorizing a textbook. It's a test of your clinical reasoning. You're going to see these clinical vignettes that force you to make decisions under pressure. They want to know, can you figure out the next best step? Can you prioritize in an emergency? Can you spot those critical red flags?
So, how do we get out of that random study trap? Simple. We decode the exam structure. I call this the blueprint buckets approach, and trust me, it's the key to putting your energy where it's going to have the biggest impact.
And this right here, this chart is basically your treasure map. The exam content falls into these super predictable buckets. I mean, look at this. Internal medicine and emergencies make up a massive 40% of the exam. OBGYN is next at 20%. Then you've got pediatrics and surgery both at 15%. And that last 10%, psychiatry and ethics. It's so often underestimated, but it is packed with easy points if you just prepare for it.
So, let's dive into that huge 40% chunk of internal medicine. Where do you get the most bang for your buck? It's right here. The exam just loves testing your ability to tell the difference between life-threatening conditions. Can you spot acute coronary syndrome versus something that just looks like it? Can you handle an acute crisis of heart failure or COPD? Do you know the critical first steps for sepsis? Let me tell you, mastering these core topics is absolutely non-negotiable for a high score.
Okay, so now you know what to study. But the big question is, how? How you actually structure your time from today until exam day. Let's walk through a really simple but powerful three-phase plan that turns this blueprint into a real schedule.
Here it is, your study architecture. Phase 1, for the first 2 or 3 weeks, is all about building your foundation. You learn the core algorithms for all those high-impact topics we just talked about. Phase 2, which is the bulk of your prep, is all about MCQs. You do question blocks every single day. But here's the key. You deeply review every single answer choice to understand why it's right or wrong. And finally, Phase 3 is for mock tests. This is where you get your pacing down and hunt down any of your remaining weak spots.
You know, building a great plan is half the battle. The other half is avoiding the common traps that can absolutely destroy your score, no matter how hard you study. So let's cover the biggest score-killing mistakes I see candidates make over and over again.
This slide really just says it all. This is the mental shift you need to make. The ineffective approach is memorizing isolated facts and just randomly doing questions. The high-scoring approach, it's all about learning clinical algorithms and deeply reviewing every single question to understand the why behind the right and the wrong answers. It's a totally different mindset, and it's way, way more effective.
But out of all those mistakes, this is the one. This is the one that sinks more people than anything else. You can have all the knowledge in the world, but if that knowledge isn't paired with structure and good timing, it's useless on exam day. Good knowledge plus bad timing equals a low score. It really is that simple. Your structure is everything.
Okay, we've covered the what, the how, and the what not to do. So let's wrap this all up with a really clear action plan that you can start putting into practice today.
All right, let's make this real. As soon as we're done here, I want you to do 4 things. 1, write down those 5 content buckets and their percentages. Put it on a sticky note, on your wall, somewhere you'll see it every single day. 2, decide on a daily question quota and commit to it. 3, schedule a time each week to review your progress and really attack your weak areas. And 4, go book your mock tests now so they are locked into your calendar for that crucial final month.
So, if you only take one single thing away from all of this,
Let it be this simple idea. A structured plan that's based on the exam's blueprint will always beat months of random, unfocused studying. Trust the blueprint, stick to the plan, and you will be on the right path to crushing the EMREE.